an antibody to that protein. We can take that antibody, and the next time the coronavirus is floating around, we'll glob onto its spike protein and neutralize it. In theory, that's what's supposed to happen. But instead what happens is once we've gone through that manufacturing and we've created that spike protein, there's a lot of different things that can happen with it. For one thing, it can irrevocably bind to the surface of your cells. The other thing that protein can do is, but through a process called transfection, can go backwards. The protein then can bind to your DNA and irreversibly change it. The third thing that spike protein can do once we've manufactured it is, yes, we can make antibodies to that spike protein. The problem is there's a real issue with the antibodies that are created through this process. Under normal vaccination, like for, say, flu shots or the measles or shingles or the chickenpox, we make a particular type of antibody that's called a neutralizing antibody. When that binds to those recurrent viruses, it gobbles them up, brings in your white blood cells, and disposes of it. We don't even know that happens. It happens all day long in our immune system. But the anti-spike antibodies, I've mapped out about 10 different mechanisms of injury that anti-spike antibody can cause inside of your body once it's been created by that process, that manufacturing process I just described. That anti-spike antibody that's supposed to be there to keep you from getting sick, actually, if you produce it in very high quantities, can have direct adverse effects on your tissues, primarily your lungs, but also to the liver, to the kidney, and to your heart. And there's multiple other mechanisms of how that anti-spike antibody can cause harm. So when people think about, well, they say coronavirus, all that circulating coronaviruses out there that we've known have been around for, since about 2000, for 60 years, they've been able to document coronaviruses. On an annual, normal basis, coronaviruses cause something that looks like the flu. So and we've heard that a lot. We've heard about coronavirus illness and coronavirus, causes kind of like a cold. So if I get this shot, it's just like getting a flu shot, and it'll keep me from getting sick like the flu shot's supposed to do. But the Moderna vaccine and the Pfizer shot, the Moderna shot and the Pfizer shot, they act by a completely different mechanism. So this is not just another flu shot. It's not FDA approved because, remember, they've tried to been doing this for almost 20 years. They couldn't get it past safety studies and efficacy studies, meaning it keeps people from getting sick. It's completely experimental. They've never done this before. It was put into the market by something called an EUA, which is Emergency Utilization Authorization. So under the stated emergency of the pandemic, the pharmaceutical companies, Pfizer, Moderna, J&J, and there are 77 more of these shots, 77 more of these vaccinations under current development. And there's 78 more in animal studies. It's beyond me why we need 150 of these. But it's not been FDA approved. It's totally experimental. It's authorized only under experimental emergency use. We have zero long-term studies on what's going to happen down the road with this anti-spike antibody, what can happen with autoimmune diseases, with neurological conditions, with cardiovascular type of conditions. In fact, humanity right now as we speak, we are the experiment. They will find out long-term what's happened to us, and we're their study.
Wow. Dr. Sherry, thank you so much for sharing all of that information. I'm curious, can you tell us about the Johnson & Johnson vaccine and how that one is different as well?
It's very different because it bypasses that manufacturing process and the recipe, the manufacturing, and the creating of the protein. What they've actually done with the J&J shot is they've actually taken an adenovirus, a typical adenovirus that causes the cold, and they shelled it out. They've taken the genetic material of that adenovirus out from the the genetic material of that adenovirus out from the inside, and they've taken an already been made spike protein and put it inside of the adenovirus shell. In order to grow that and replicate it, to make it grow, they are using at least one and maybe two different types of tissue cells that come from aborted fetal tissue. One is called PCR.C6, which comes from retinal tissues of previously aborted fetal tissues. And there's another one called HEK that comes from a kidney of a previously aborted fetus. They have to have viruses in order to get a large enough quantity to manufacture a shot or a vaccine. They have to replicate in living tissues. That's why those tissues are used. So you've got this shell of an adenovirus and you've got the protein inside of it. They inject that into your system. They inject that into your system. The shell of the adenovirus binds to your cells and again opens up like an egg and deposits that protein into your system, and the process begins to create the anti-spike antibodies. That's a foreign protein that's just been deposited into your body. It activates many of your toll-like receptors, which I think are God inside of us. The toll-like receptors separate self from non-self, and toll-like receptors are able to tell what's a foreign protein versus your natural in your body protein. There's a huge amount of immunology that happens there. You get a lot of cytokines, which can cause inflammation. You activate the white blood cells, the neutrophils in the bloodstream, and the macrophages in your tissue. There's all this activity that happens, an acute flare-up to create this anti-spike antibody. Now, the anti-spike antibody is going to be the same or very, very similar in all three of those vaccines because that's the end result, is to make the anti-spike antibody.
Okay, so I know that the CDC, and they have actually given these numbers that as of a few days ago, there were 996 deaths from the COVID-19.
So actually, I got some. It's actually more than that.
Okay.
That was from about 4 weeks ago. The updated date that came from February the 28th. In 1 week, we went from 1,097 reported deaths to 1,278 reported deaths. In 1 week, we went from just under 19,000 reported adverse events to over 25,000 reported events. That's the Vaccine Adverse Event Reporting System, which is a voluntary reporting system, and it's well known that that database captures about 10% of adverse events. So we could be looking at right now as many as 12,000 deaths. And can you think of one single product? Can you think of any product in any industry, across the board, any industry, that if somewhere between 1,200 and 12,000 people had been killed using it in the first 10 weeks of use, that it would still be on the market? And not only still on the market, but heavy-handedly pushed to get people to use it or to take it. It's just an enigma to me.
And the real question is, like you mentioned, 6 months from now, a year from now, that's when we're really going to see what these vaccines have done to people. And you expect what, autoimmune disorders, heart, kidney, lung issues. Do you see that happening?
All of them. There was a study that came out the middle of January by a very well-respected, highly respected immunology group in California. And what they did was they said, when we create this anti-spike antibody, does it just go after the virus, the one that you might be re-exposed to, or maybe one of the coronaviruses? Or can it cross-react with your body, which is what autoimmune disease is? So they took tissue samples and they put them in what they call little wells. They're like little wells. They look like little Dixie cup wells. And they put samples of 55 different tissue types in these little wells. Then they dropped serum that had the anti-spike antibody on it and saw what the reaction was. And what they found was that the antibody cross-reacted with 28 different tissue types. One of the highest concentrations, one of the highest aggregations of where the antibody attached to was the mitochondria. The mitochondria are the inner lining of the mitochondria, to be exact. The mitochondria are little organelles inside of every muscle system in your body that they produce your chemistry. They produce your gasoline, and your body's gasoline is called ATP. So ATP is the gasoline that runs your body, and it's produced internally by the mitochondria. The antibody attack the mitochondria and make it not work correctly. And I believe, it's my opinion, that that's one of the reasons why one of the most profound side effects from after people have experienced that, after they've received one of these 3 approved shots, is profound fatigue. It's because you've just taken a handful of salt and you've thrown it in the engine of your car and you expect it to produce energy. It can't produce energy. In fact, the most common side effects that we see, even after the injection, are headaches and profound fatigue. And they know that this protein, and they believe the antibodies also can cross the blood-brain barrier and get into the brain and attack at least 3, if not 4 different types of tissue types that were discovered by this group out of California who did the research.
Also, one of the things that we just found out about is for the Johnson & Johnson vaccine, they're actually testing it on infants and pregnant women. How is it possible, or how is it legal to test it on a newborn when they can't give consent?
Well, that's a really, really good question. It would make you want to know how they approved any of the vaccines that are given to children under 6 months of age, because they can't give informed consent. When I started hearing that J&J wanted to now start testing this on newborns, I thought, why? The children under the age of 12 rarely, if ever, contract this infection. All of the death rate amongst children under the age of 12 is as close to 0 as it can possibly get. All of this nonsense that we have done, the destructive, psychological, emotional nonsense that we've done to children by masking them, separating them, keeping them from home, not allowing them to do any of the things that normal kids in grade school are supposed to do, growing these children up to not understand the subtleties of facial expression, to make them be fearful of people who don't have a mask, to make them to be, when they should be fearful of people who do have a mask, who might kidnap them. I mean, and now when they want to start trying to experiment with a completely experimental type of shot, never before done on human beings in general, now they want to do this on newborns. It's a crime against humanity. It's an absolute assault on children of God.
Wow. We only have a few minutes left. Susie, quickly, your question.
My question was, I know several people in my neighborhood and stuff who've got the vaccine and have talked about those same side effects that you mentioned. And so, it's natural to just worry about them. What advice would you give to people who've got these vaccines and are now getting this information and they're scared? What would you say to them?
Well, it's a disturbing answer that you don't want to hear. With the types of things that this injection does, binding the spike protein to the surface of your cells, making an antibody, which means you're sensitized to that forever, through a process called transfection, binding spike protein to your cells. Once you've been vaccinated, it is the mark. You cannot become unvaccinated. A lot of the other vaccines, people want to know what they can do to detox from the mercury or the aluminum or the viruses. This is an irreversible thing. Once you have decided and made it an uninformed decision, I can't tell you how many people say, I don't even